Namaste and good afternoon. Greetings from all of us at Apollo Hospitals. This is Dr. Srinidhi Chidambaram, and I'm very happy to see you all again. I hope you've been well and in the best of health and spirits. The first step to conquering any disease or health condition would be to understand it thoroughly. However, this is not always easy as medicine is a complex subject and there is enough of misinformation out there on social media that can confuse and mislead. I'm so happy that you have joined our Facebook Live session today, where we aim to simplify and demystify health for you so that you can be armed with the right knowledge and ready to tackle any health issue without stress. Many of us worry about our elders, senior citizens, about their memory and their thinking abilities. For example, we may be concerned that older people in our family taking longer than before to learn new things, or sometimes they may forget names or forget to pay a bill, for example. Now, these changes are not always something to be anxious about. They may be signs of a normal aging process, not serious memory problems. Dementia, however, is another aspect totally. It is not a part of normal aging. It includes the loss of cognitive functioning, thinking, remembering, learning, reasoning, and behavioral abilities too, to the extent that it can affect quality of life and activities. So we have to know to distinguish between uh, forgetfulness or memory changes as part of normal aging process as opposed to dementia, and also one of the most common forms of dementia, which we all know about, which is Alzheimer's dementia. So, what's the difference between age related memory problems and forgetfulness, and something that is of concern? So, to explain this important aspect to us today, we have with us Dr. Sandeep Nayani, who is the consultant neurologist from Apollo Health City, Jubilee Hills, Hyderabad. Dr. Nayani completed his MBBS from the Rangaraya Medical College, Kakinada, in Andhra Pradesh, and then his MD in General Medicine from the Kasturba Medical College, Manipal, and then his DM Neurology from the Sri Chitra Tirunal Institute for Medical Sciences and Technology, Trivandrum. He has spent several years working in both the Manipal Hospital, Kasturba Medical College Hospital, as well as the Sri Chitra Tirunal Institute for Medical Sciences and Technology, and has been a consultant neurologist at Apollo Health City, Jubilee Hills, Hyderabad from 2015. Dr. Nayani has also won several awards for his papers and poster presentations. His specific interests are in epilepsy, stroke, movement disorders, central nervous system infections, and other autoimmune conditions. Welcome, Dr. Nayani, to this Facebook Live session. Thank you so much for joining us. So let us begin by uh, asking you, what are the symptoms that occur as a person ages, which is related to memory and mental health?
Yes, thank you, Dr. Srinidhi. Thank you for having me here. So, like you rightly pointed out, normal aging itself will cause a lot of cognitive changes, as in people will be forgetting things. People will be forgetting things like buying groceries. They may be forgetting some items. They may be misplacing their items and search for them. They may forget people's names. They may forget some information that is given to them. They may be confused about the date and time. So these things can happen normally with aging, especially after 70s and 80s. Even as a part of normal aging, people can experience these symptoms once in a while, but that usually doesn't interfere with their daily functioning, both in their social sphere as well as in their professional sphere, in case they're doing some professional work, or let's say in case of somebody who is at home, whatever work at home they're doing, that usually does not get interfered in a normal aging. These kind of minor forgetfulness usually does not interfere with their functioning when it is a normal aging process.
So memory loss is also part of aging, you're saying?
Yes, memory loss is a definitely a part of aging. Normally, as we age, after a certain age, especially after 60s and 70s, the brain starts shrinking in size. So there is shrinkage of the brain compared to the brain when it is 30-40-year-old brain. In 60s and 70s, the brain shrinks significantly. So because of that, forgetfulness with age is quite common and need not necessarily be a symptom of a disease or a symptom of what we call as a dementia. Forgetfulness with aging, because of the normal physiological brain degeneration and brain shrinkage, can be quite normal.
So how do you differentiate, or what is the point where one should start worrying about the fact that it is probably not normal aging process and there's something else beyond that? So what is really the difference?
Yeah, that's a very important question. So like we already discussed, people can have forgetfulness. They may forget things. They may misplace things. When these symptoms occur very frequently, or these symptoms are so severe or so frequent that they're impairing the daily activities, impairing the minimal functioning of the person in his day-to-day activities in his social sphere. That's when we suspect it could be something more than just forgetfulness of the normal aging. It could be something like a dementia. And to call it as dementia, there will be dysfunction not just in the sphere of memory, but in other spheres as well, like in like getting confused about where to go around, what we call as visuospatial dysfunction, having confusion going from one place to another place, even at home or outside, or having difficulty in speaking fluently, having difficulty doing the routine tasks. All these, along with forgetfulness for recent events, when they happen and they are severe enough to hamper the daily functioning of the person, then we have to suspect it could be something more than just a memory loss of normal aging, and we have to suspect it could be something like a dementia.
So what is a dementia? What happens exactly in dementia?
Yeah. So dementia is a condition where there is cognitive dysfunction. So where the brain function is affected in such a way that the person is having memory loss or impairment of recent memory. That is, they're forgetting the recent events that happened, whether it happened that same day morning or whether it happened the previous day. They are unable to recollect and remember. Along with that, they are having difficulty in their routine functioning. For example, a housewife is unable to cook a meal or buy groceries, prepare the finances for the month, or making mistakes in all these things, or finding it difficult to go from one place to another place within the house, getting confused as to what time of day it is and where the person is, unable to speak fluently like before. All these together, when they happen, that's when we suspect that all these symptoms, which happen more frequently, once in a while, if they happen, again, that's a different thing. If they happen consistently and frequently and impair the patient's or the person's quality of life and functioning, that's when we suspect it could be a dementia.
So are there different types of dementia?
Yes, there are different types of dementia. So dementia can happen due to many reasons. So the more common type is the dementia that happens due to neurodegeneration. Neurodegeneration, as in brain degeneration. The brain is degenerating. So among the brain degeneration causing dementia, Alzheimer's happens to be the most common cause. So almost 70% of dementia is Alzheimer's when it happens in elderly people, when it happens in people who are older than 70 years. However, Alzheimer's is not the only cause of dementia. There are various other causes of dementia. There are various other types of neurodegenerative dementias. To name a few, there are diseases called frontotemporal dementia, Lewy body dementia, vascular dementia. Along with that, there are many dementias which can be acquired or which can happen due to various things like drugs, alcohol, nutritional deficiencies, trauma. There are many dementias which may be reversible. They are happening due to a specific cause, and once we treat the cause, they may be reversible. So all dementias are not Alzheimer's. Alzheimer's is only the most common cause of dementia.
So what exactly is Alzheimer's dementia? What is the pathology that happens in it?
So in Alzheimer's dementia, along with aging, certain amyloid particles or deposit happen in certain areas of the brain. The areas of the brain that are most affected are the ones that are concerned with memory, especially the recent memory. So the areas of the brain affected are hippocampus and temporal lobes. So these are the areas which predominantly deal with, like, different areas of brain have different functioning. So certain areas deal with memory, certain areas deal with day-to-day functioning. So the temporal lobe and hippocampus are the areas that deal with recent memory. So that is the reason in Alzheimer's there are some abnormal deposits happening in these areas, because of which those areas are not functioning properly, and that is leading to recent memory impairment, and subsequently it is leading to dysfunction in other spheres, which is causing various other symptoms like confusion, disorientation to place, and speech problem. All these things subsequently happen in Alzheimer's dementia.
So what are the earliest signs that, that we can suspect that somebody may be having Alzheimer's?
Yeah. So, so in advanced dementias, they will have everything. They will have all the symptoms, all the systems will get affected. As in, they will not be able to function at all. So it is difficult to differentiate one dementia from the other in advanced stages. But like you rightly asked, early stages are where it is important to identify the disease. And in early stages of Alzheimer's, uh, uh, people tend to predominantly have forgetfulness for recent events. That's what we call as recent memory impairment. The remote memory will be very good. They'll be able to remember what happened 15 years back, important events that happened 15 years back, 10 years back. They may be able to tell their school name, or their birthday, their place of birth. They may be able to tell very detailed information about all the old things. But something that happened yesterday, or something that happened that day morning, or some person they have met a couple of days back, these are the ones that are most affected. Subsequently, there may be affection in doing day-to-day functions, like doing skill activities, like let's say drawing money from an ATM or operating a mobile phone, cooking. These tasks may get affected. Then they can get confused to find their way at home. So subsequently, these things keep getting affected. But the first thing and the most striking thing will be recent memory impairment, which is happening consistently, and which is happening so significantly that it is affecting their day-to-day activities, that they're not able to connect one event to the other.
So what are the causes of Alzheimer's dementia?
So Alzheimer's, like I already said, is a neurodegenerative disease. So there is no one specific cause for this disease, but there are certain factors which are found to influence or cause Alzheimer's. Genetic factors are there. Certain people are more predisposed to get Alzheimer's. If someone has a first degree relative who previously had Alzheimer's, they are more likely to develop Alzheimer's disease in the future. That genetic aspect is there, but genetics is not the only thing. There are various environmental factors that can also influence. So various studies have found that certain things have more tendency to cause Alzheimer's, like low educational status. If somebody didn't attain a higher educational status, that itself is a risk factor for developing Alzheimer's in the future. Low education, as well as uh, like someone who was in a higher profession has lesser tendency to have Alzheimer's than someone who was not in any profession. So professional status, educational status, nutritional status, like lack of adequate nutrition. All these can predispose someone to have Alzheimer's. Similarly, the risk factors, the traditional vascular risk factors like diabetes, hypertension, obesity, lack of physical exercise, lack of proper diet, and sedentary lifestyle, these, like they cause heart attacks, like they cause brain strokes, they have a tendency to cause Alzheimer's also later in the life. So these are all the various causes of Alzheimer's disease.
Right. Are there any stages in this disease? Does it evolve from one stage to the next?
Yes. Alzheimer's disease evolves through various stages. There is a preclinical or a prodromal stage which can last for a very long time, which can last for up to 10 years before any symptoms happen. So that is the stage in which it is difficult to detect the detect the disease because there are no symptoms. But various studies are being done to detect the disease in preclinical stage because any disease modifying therapy, any treatment, any drug or any cure, if you want to find, it usually does not have any much of benefit once the disease starts. So if you can identify the disease at preclinical stage, potentially in future we may develop some therapies which can halt the disease and prevent it from developing into a clinical Alzheimer's. As of now, we don't have that treatment, but potentially that may be a future thing that we can develop. Preclinical stage, symptoms may not be there. Only if you do a scan, like a PET scan or something, we may be able to see some changes in the brain. Subsequently, the preclinical stage may vary from 5 to 10 years, and then they develop a stage called as a mild cognitive impairment, where people tend to forget things minimally, but again, not so severe to call it dementia. They're still able to function normally. They're just forgetting things. Very frequently, they are forgetting things, or they're doing some mistakes at their workplace. They're missing important information. So that stage is called as a mild cognitive impairment because there are some symptoms, but they are still able to do their routine functioning and activities without major hampering. Subsequently, there are stages. Once it progresses to Alzheimer's, there is a mild Alzheimer's, moderate Alzheimer's, and severe Alzheimer's. In mild Alzheimer's, symptoms are there. It is interfering with person's functioning, but still with minimal assistance from family members, a person is able to get along. Moderate Alzheimer's, it becomes quite difficult. Needs constant support, needs constant caregiver attention. And when it comes to severe Alzheimer's, person is literally completely dependent on others for even day-to-day activities like brushing and taking bath and dressing. So that's the stage of severe or advanced Alzheimer's disease.
So is this more common in men or women, doctor?
So Alzheimer's worldwide is found to be more common in women than in men. The incidence is found to be more common in women. Uh, Women also have a longer life expectancy, so maybe that plays a factor because it's a disease of old age. So as number of people who are more than 65 increase, more than 70 increase, the disease prevalence also may increase. But in general, it was found that it is more common in women than in men.
But is there an entity called early onset Alzheimer's also? So who does that affect? I mean, like at what age does it happen?
Yes. So the more common type of Alzheimer's is something that happens in 70s and 80s. Especially after 80s, Alzheimer's is quite common. But certain people can get Alzheimer's disease even before 65 years. So when it happens before 65 years of age, we call it young onset Alzheimer's disease or young onset dementia. So there are various factors for that. It can have some genetic, especially when there is a genetic predisposition. Certain types of genes can cause Alzheimer's. Uh, in those types of Alzheimer's, the disease can start quite early in 30s or 40s also. Uh, Again, risk factors, like if there are more risk factors like diabetes, hypertension, and all, if they're not controlled, if individual had strokes in the brain, that along with Alzheimer's, when they combine together, this can happen little earlier than the usual time.
What about diagnosis and treatment of Alzheimer's? So once somebody is suspected to have dementia, what are the next steps?
Yes. So when somebody is suspected to have dementia, first thing like a caregiver or a family member has to do is bring it to attention of a neurologist. What is important is a detailed history as in what the neurologist will inquire as to what happened first, what was the first symptom that came up, and subsequently what happened. They will take a detailed history of how the symptoms have progressed. So lot of times that is what will tell us what is the diagnosis, rather than any other test or any other examination. So history of how the disease progressed is very important. Along with that, we also do a detailed memory testing to see which part of the brain is more affected. Because, like I said, there are various types of dementia, and each dementia, certain area may be more affected than the other. So, which area is more affected on memory testing and brain function testing will tell us whether it is Alzheimer's or whether it is a different type of dementia, whether it is some treatable dementia. So, all these things we will know. Subsequently, once we do history and examination and we come to a conclusion as to what could be the type of dementia, we do some tests, because that will confirm the type of dementia. So basic blood tests will be required. Some vitamin levels like vitamin B12 levels, thyroid levels, all this will be required to rule out any treatable causes. And then we do brain scan. Ideally, an MRI scan of the brain is required to see if there is any shrinkage of the brain in the areas that we suspect. Along with that, we also want to rule out any other causes. So for that also, we need a MRI of the brain. In certain selected cases, we may have to do what is called as a PET scan when we are in dilemma as to what is the diagnosis. PET scan may be useful to identify which areas are more selectively affected so that we can arrive at the diagnosis.
So has there been an increase in diagnosis of Alzheimer's in the past decade, for example, as compared to before? Is the prevalence increasing?
Yes. Especially in our country and in developing countries, the prevalence of Alzheimer's is increasing. One reason for that could be better detection. Previously, it was probably not detected, and now we are detecting. And second reason could be the longevity, better longevity. Previously, the life expectancy was like lesser than what it is now. So as there are more people who are more than 60 and 70 years old, the population of people who are 70 plus is much more now compared to what it was in the last decade. So that could be also one reason why the prevalence appears to have increased.
You were saying that, at the moment there's no cure as such for Alzheimer's, but what are the types of treatments that are given?
Yes. So in medicine, cure means that you give something and then it completely disappears, and you don't have it for the rest of your life. So unfortunately, there is no cure available for Alzheimer's disease, but there are certain medicines that were developed and they were tested and found to be useful. So these medicines increase the levels of certain chemicals in the brain, which will improve the memory. So there are medications like medications that will increase the acetylcholine receptor levels in the brain. So there are medications like donepezil, memantine. So all these will, to some extent, improve the brain function and also the memory, but they don't completely cure the disease.
Is there any way to prevent any like apart from Alzheimer's, other types of dementia as well?
So that's a very important question because, like we discussed, there is no cure. So prevention is all we can hope. So it may not be completely possible to prevent it from developing, but certain measures will definitely reduce the chance of having Alzheimer's. So, like I discussed, genetics is not the only thing. Environmental factors can play a role. So, people, especially elderly people who are in their 50s and 60s, especially in their 60s and 70s, if they can stay mentally active, keep solving puzzles, reading books, keep themselves busy with some information, interact with their peers, keep the mind active, and also do physical exercise, avoid sedentary lifestyle. All these are found to be beneficial for the brain health. So solving puzzles, Sudoku, this type of things, as well as social interactions. Uh, these are the ones that are found to be highly effective. Certain types of diet also, diet that is rich in rich in vegetables, nuts, dry fruits. So this type of diet also can play a role and prevent to some extent development of dementias. Along with that, sorry to interrupt. So along with that, like you asked, other than Alzheimer's, there are many other types of dementias that can happen. There, in those dementias, there is higher role for prevention. So especially alcohol is found to be a major cause of dementia. So heavy alcohol intake can cause dementia. So that is alcohol, smoking. These are important factors. Trauma to the head also is something. Repeated trauma to the head or major head injuries can cause dementia. So that is one area where we can prevent the development of dementia.
So thank you, Dr. Nayani, for this very insightful session. So viewers, we have heard from the doctor that memory and thinking problems, memory loss, forgetfulness can have many causes. So not all of them are dementia or Alzheimer's. It can be due to age or infections, medication side effects, or due to so many other reasons. Sometimes the problem can be treated and cognition improves, but sometimes it is due to Alzheimer's and other types of dementia, which are not so amenable for treatment. But what is important here is that we have to find the cause of the problem. So as soon as there is any symptoms of concern, I think it's important to consult your doctor and then decide on the best course of action. Once you know the cause, you can make the right treatment plan. So please contact us for any further clarifications, and also you know that we are available on all the social media channels, so you can post in your queries at any time, and we're also available at our hospitals and clinics throughout the country for any assistance or consultation at any time. Thank you so much. Stay safe, stay healthy. Namaste.